Hello, I'm Luciano Costa, and at ASH 2025, I had the opportunity to present the long-term progression-free survival benefit with Cilta-cel in standard-risk relapsed refractory multiple myeloma. So this data comes essentially from the CARTITUDE-4 trial. The CARTITUDE-4 trial was a randomized phase 3 trial where patients with 1 to 3 prior lines of therapy in lenalidomide-refractory myeloma were randomized to receiving a standard of care triplet, which was PVD or DPD until progression, or receive PVD or DPD for 1 to 2 cycles of bridge therapy, followed by a single infusion of Cilta-cel therapy. And those patients were followed for progression-free survival and several other secondary endpoints. This was a very positive trial showing both PFS and overall survival advantage for Cilta-cel over the control arm. But because of the somewhat complexity and awareness of some of the long-term toxicities of Cilta-cel, there was a natural tendency among ourselves, myeloma physicians, to deploy this therapy, particularly in patients with perceived cytogenetic high-risk disease. So the objective of today's presentation is really to emphasize the outcomes of those patients with standard risk disease who received this therapy in the context of this trial. So the trial had 211 patients with the standard of care arms, 208 in the Cilta-cel arm, and there were patients who met the standard risk definition, which are patients without 17p, 1416, 414, and or gain of 1q. Those are 59 patients who are infused and 69 of the entire analysis. There were also 46 patients who only cytogenetic high-risk abnormalities was 1q. And those patients were included in a cohort on this analysis, so they could make a parallel between a population with the same cytogenetic group definition treated on CARTITUDE-1, so we can see the different performance of this therapy for patients with similar cytogenetic risk with different numbers of prior lines of therapy. So this is the top line result that had been previously presented. And essentially, you see an advantage for Cilta-cel over standard of care for both cytogenetic high risk and cytogenetic standard risk disease by intention to treatment in both progression-free survival and also in overall survival. Now, if we look for patients as treated, then you see a difference here of patients in CARTITUDE-4 have a 92% CR rate versus 82% in CARTITUDE-1, so a more heavily pretreated patient population. And that persists even if we include the gain 1q abnormality, making a parallel with the CARTITUDE-1 population. So using Cilta-cel in earlier lines, not surprisingly, leads to 100% response and an even higher proportion of patients obtaining CR or better. So when you look at the progression-free survival, the 30-month progression-free survival rate for the standard risk patients is 80.5% after a single infusion of Cilta-cel. And that overall survival is 87.3%. If you go on to include the patients with 1q to make a parallel with CARTITUDE-1, you will maintain some very high PFS rate, 72%, and 86% overall survival rate. And that compares very favorably with what you observe for the same cytogenetically defined population on CARTITUDE-1, where patients had at least 3 and many more than 3 prior lines of therapy, where the corresponding 30-month progression-free survival was 60% and the 30-month overall survival was 71%. So the early use of Cilta-cel leads to even better progression-free and overall survival for the same cytogenetically defined standard risk population. We also did a very interesting analysis, a landmark analysis for the patients who are alive and progression-free after 1 year. And observing those patients without any further therapy, 93% of them are progression-free after 30 months from therapy, therefore 18 months from that period of observation of 1 year. and the same 93.7% of the patients are alive. However, if you go to those patients at 1 year and look at MRD data, those who had MRD evaluable, which was 32, 81% of those patients were MRD negative. And for those MRD negative patients at 1 year, not a single patient has had a progression event. So that really speaks for the durability and the depth of those responses in those patients. Of course, so we have to talk about toxicity, and here you have the top line adverse events for those 59 patients who received Cilta-cel with standard risk disease. The toxicity in general is not different from what has been reported before for CARTITUDE-4, but it's important to highlight that we had 8 secondary primary malignancies, mostly cutaneous, no invasive, but there are 0 hematologic malignancies. And those are the non-relapse mortality, where 6 patients or 10.2%, some in the first year, only 2 beyond the first year, and including 2 secondary malignancies, and none of which were hematologic. So this safety profile does not seem to be any different from what we expect in the overall study population. So if you look at the top line results, Cilta-cel in this CARTITUDE-4 population with a median of 2 prior line of therapy lead to a 30-month PFS of 80.5%, and 30-month overall survival 87.3%. If you include the 1Q, then you have a 72% PFS, 86% 30-month OS, and that compares favorably with what you see on the CARTITUDE-1 population with a median 6 prior lines, where you have 60% 30-month PFS and 70.6% 30-month OS. Again, speaking for the early use of Cilta-cel, yielding even better results that you saw on CARTITUDE-1. So in summary, Cilta-cel benefit risk profile in CARTITUDE-4 standard risk as treated populations support the early use. With 80% of the patients were free from progression without treatment at 2.5 years, and 93% of the patients who are progression-free at 1 year remains progression-free at 2.5 years. In the of patients who are MRD negative, 100% remain progression-free at 25 years. There was no new safety signal, and again, we believe that the low rate of progression events in patients with standard risk relapsed refractory myeloma is indicative of a potential cure fraction, which will be further defined with additional study follow-up. Thank you very much.